Oh, hi, Dr. Henry. While the province's vaccination rate is climbing, there are still some areas with lower coverage. One of them we noticed in Metro Vancouver is Richmond. Can you tell me what you think is happening in Richmond? And also, generally, what is the message for those who have yet to get a first dose, and how is BC encouraging them to do that?
Yeah, so we have been obviously looking at this in some detail in many different communities. So we're, Dr. Balam calls it our ground game, and so we've advanced that in many different fronts. So that is connecting with community leaders, connecting with faith leaders, connecting with other parts of where people are in different communities to bring vaccine to them. We know that most people are doing the right thing and getting on board and coming to the clinics, but for some people it's more of a challenge. So in the interior, we've been seeing mobile clinics going around to smaller communities where it is more difficult for people to access one of the standing clinics. We've also seen the easy clinics popping up in and around Fraser Health and similar things in Richmond. There's been work done with Vancouver Coastal, working with different community groups to basically spread the word and make it easier for people. And I've talked about this before. We know that we reach a certain level, and then we have to take different strategies to reach people. And there's a couple of different things that are of a concern. Sometimes it's complacency, and that certainly is a factor in many of the more rural communities where there's not a lot of transmission, and it takes a great deal of effort to go out and actually find a vaccine. So making it easier for people, understanding that it's not just protecting you, but it is protecting us all, making it convenient. And the other one is having confidence in the vaccine. So those are all things that we're working on in different areas of the province, and there's all kinds of innovative things that are going on in different places. In Richmond, I know you...
Yeah, I just want to recognize the people of Richmond, our MLAs who have been incredible leaders on both sides of the House, the mayor, the community, Vancouver Coastal Health, Dr. Balam. If you look at Richmond's numbers now and where we were a few weeks ago, Richmond is now, in terms of registration, above the provincial average in terms of registration, and the gap that existed on vaccination is closing and closing fast. So I think that is a real achievement for people in Richmond. I want to acknowledge everyone, people in media who supported this in Richmond and getting information out, the clinics that were provided. It's really a remarkable achievement. And we're going to do the same kind of things across the province. For example, the first dose immunization clinic in Cherryville at Frank's Grocery. The fact that there are BC CDC nurses, a number of them since the beginning of June in Fort St. John, 4 more coming next week to increase the number of immunizations. And we're doing lots of work we're going to be doing lots of work with the mayor in Dawson Creek and in Fort St. John on those questions. So we're going to go step by step and increase those immunization rates everywhere. That's the plan, to work with communities and to support communities. And I think these are good examples. A number of weeks ago, you saw UBC very low in terms of immunization as a community health service area, because UBC has a lot of young people, and this was an age-based process. Well, you've seen now that number comes significantly up, but in terms of registrations, it's above the provincial average. So I think that what we're seeing is that work getting done everywhere in the province, and we're just going to keep working with communities to raise those levels, because it's important. It's as important in Surrey and Delta and Richmond as it is in Fort St. John and Dawson Creek and Cherryville, and we have to continue to do that work.